Welcome back to Fox 2 News at 5. By this time next year, all healthcare providers will be able to track a patient's prescriptions with the goal of preventing overdoses and opioid abuse.
Our Missouri Chief Capitol Bureau reporter Emily Manley is live in Jefferson City to explain Missouri's prescription drug monitoring program. Emily.
Jasmine, Missouri is the last state in the entire country to have a statewide prescription drug monitoring program. Now, even though that legislation was approved last year, it's still going to be months until that program comes online. So I sat down today with the executive director of the program to ask why it's taken so long, but also how the system will work.
Every opportunity we have to lower the number of pills in circulation is an opportunity to save a life.
Overseen by a task force of licensed healthcare professionals. Missouri's new prescription drug monitoring program, or PDMP, will allow physicians and pharmacists to track prescriptions.
It goes into the system, and then providers will be able to look at that information again to make better decisions.
Dean Linneman is the program's executive director.
If you go to another physician, you go to your dentist, you go to anyone else who has prescribing authority, they will be able to check the PDMP to see if you've had any other opioid type of prescriptions.
But the system will not track all prescriptions. The drugs are based off the ability to become addictive and include Schedule 2, 3, and 4 controlled substances like morphine, Vicodin, Oxycontin, testosterone, Xanax, or Ambien.
Not every Missourian is going to be in the PDMP. It's only those that have been prescribed and dispensed controlled substances. There will be no law enforcement. There will be no even licensing boards in the state of Missouri will not have access to that information.
In 2020, nearly 1,900 Missourians died from an overdose. Now, the state has set $2 million aside for the new program.
We are trying to take advantage of lessons learned from other states, and the other states, they've wanted Missouri to have this for a long time and have been very cooperative.
Now, currently, 85% of the state uses St. Louis County's PDMP, which will dissolve after the statewide program comes online, which is expected in March of 2023. Also, if a provider does not enter a patient's information into the database, he or she could have a fine up to $1,000. Reporting live tonight from Missouri State Capitol Bureau in Jefferson City, I'm Emily Manley, Fox 2 News.